So why don't we go ahead and get started on this, because I know there is precious little time left, but just to say hello and welcome to everybody for this breakout room as part of the health innovation thing. I think what we can do is get started with Priyanka. So Priyanka, I've got your slide deck in front of me and I'm gonna open it up for you so that you can get started. Why don't we do that?
Yeah, perfect, sounds good.
Hold on here while I do the Zoom magic. Share screen. There we go. And there we go. There we are. There we go. And
Great,
go ahead.
Great, so hi everyone. I'm guessing it's afternoon in most of the sites of right now. This is Priyanka Patel, representing the Kenya Red Cross from the Innovation Department. I work as the Innovations Officer. So today I'll take you through 3 of the great innovations or initiatives that we've done under the WASH department at the Red Cross. Next, please. I'm not able to change my slides.
You know, and that's because I'm supposed to do that. There you go.
Okay, thank you. So we, as soon as we had our first case of COVID, which was the 13th of March, we went into doing 1,000 ways of washing your hands challenge on our social media platforms, riding onto the WHO hashtag of safe hands. So the idea behind this was get our youth and volunteers to participate and record videos and creative ways of how they wash their hands. So then we're able to spread awareness, because in Kenya, there's I'm sure everywhere right now, the norm is not to wash your hands thoroughly for 20 seconds. So just to make them understand how this is done, we did a nomination approach. So the youth coordinator, the national youth coordinator started this off and then nominated other volunteers and youth to do so. So if we just go to the next slide, it'll show you the first video that we sent out. And I'll just request you to play that video for me, please. Great, so we're not getting the sound, but he's basically—
that is my problem. Hold on one second.
Okay.
Just started off, it's just a setting I forgot to click. There we go. And apologies about that, Priyanka.
Oh, that's okay.
But this should work now.
Actually blank on my end. I don't know if it's for everyone, but I could share my screen if that's—
it's showing on, sorry, apologies everyone. It is showing on mine.
I think from the innovation field, we understand the technical glitches sometimes.
Yes.
It's still blank, yeah.
Okay. I hugely apologize for this. Let me try sharing this once more. Are you seeing it now?
Not yet.
Yeah, because it's my computer has decided that it's time to give me an error.
I could share my screen actually.
Yeah, go ahead. Let me stop
Okay.
sharing on this, and there you go.
Okay, so I'll just quickly. Can you see my screen?
Yes.
And we are using the term
yes, you can.
Okay, so.
My name is Alex Ayub. I'm the youth coordinator at the Kenya Red Cross Society. Now, we all know about the coronavirus situation. Simple steps to make sure that you keep your hands clean. Hands clean. 1, wet your hands. Please please remember to turn off the tap, just in case you save water. Then get some soap. Basic soap will be enough. Wash your hands, inside your hands, at the back of your hands, in between your fingers, then a bit of rotational on your thumb, and for your nails, this should take you around 40 to 60 seconds. Then rinse thoroughly using water. Then please remember to dry your hands. And turn off the tap. Simple steps to keep your hands clean. Please #save hands.
Great, so that's basically Alex, who was showing step by step how hands are washed. This was the first video we used to just raise awareness and ensure that everyone at the community level also understands. We did this in Kiswahili as well, which is the local language in Kenya. And then after that, we had the TP Tap challenge. So this is a very short scheduled one. So we give our youth and volunteers, it was internal, just a 1-day timing to design TP Tap guidelines on how to make one at home using the locally available materials, which includes twigs or jerry cans or even old ropes that they have. The idea behind this was basically to ensure that they're empowered to use what they have and build their skills using that, because from the government side, we weren't able to just sustain all the hand washing facilities that are required countrywide. And this was a really great sustainable solution because we managed to gather a lot of communities that have done these even before what we shared. So I'll give you a quick example of some of the submissions that we got. We got 5 submissions within a day, which as you can see, it was hand drawn, most of the diagrams. We had requested them to do them in the local language, Kiswahili. So this was not something new. The guideline was something we found from an online diagram that was shared. But we wanted to make this more into a local context so that it's more relatable and it's also easy to scale it out and the community can own the solution then. So the winning solution was the one that I'm currently showing you right now. It shows the tools that one requires, including how the TP Tap is going to be made, and also who has to be involved, because we wanted to ensure that we have all genders included and also the age group. So we've got a small child at the last image that's using the TP Tap to wash her hands. And if you look at this slide here, then on the left side, this is by a very busy highway. And this was somewhere start of April, where one of our volunteers was showing the Motorbike Association how to wash hands without touching the jerry cans to avoid any contact, using just the simple wooden block that's down there, just tap on it and it tilts. On the right, we also have the same thing that was then duplicated after the TP Tap challenge. It was made by one of the business owners on one of the main busy roads between Nairobi and Mombasa. So this TP Tap challenge was able to help a lot of communities, and we were able to see this, that a lot of the village that are isolated far away from the city centers or the urban areas are able to quickly adapt to this, because first of all, the language was very understandable for them, and also it was very easy to design for them given the diagrams. So once we achieved that, we also tried to push this into print media, and currently the print media has already also worked on designing one with us on the same that is user-friendly for someone to understand. One of the great ones that we have tapped onto till now is the plasma water and sanitation system. So this was as a result of a funding that we had from the Airbus Foundation under one of our partnerships. And this project started off as of last year. So what basically happens is these units purify water using plasma technology to kill the bacteria. So we selected Mukuru, which is an informal settlement. The reason is also because we currently are implementing an urban resilience project within that settlement with the Danish Red Cross. So we wanted to build on current efforts, not so that we duplicate them elsewhere, but to ensure that the same community has been built with their resilience enough before we can move on to another community settlement. The idea was initially to work with communities, but we picked 7 schools because of security and also because the children there are more prone to cholera outbreaks, and we wanted to try and reduce that exposure and the risk. So the idea was, if these units are placed there, then the children who come with, water bottles can also take water home for home domestic use. At the moment, the unit produces about 5,000 liters in 20 hours. Because in Kenya, the recommended liters per household is 20 for domestic use. However, at the moment, we are using this for the COVID situation. So on the left, you'll see a diagram of the chamber where the unit is placed. On the right, that's the unit that purifies the water. The city council in Kenya, in that particular settlement, does provide safe water. However, the pipes that carry the water to households have leakage, and there are high chances of bacteria that flow into these pipes. So this is an extra precaution to just ensure that they have safe and clean water for domestic use. This is a photo that we captured last week. Because of the corona situation, water has been highly in demand at the moment, and given that they need safe, clean water also for domestic cooking purposes or even drinking purposes, the school has permitted 60 households within the area to access these units. As much as schools are closed, these parents can come and collect water for daily use, and it's able to produce about 1,500 liters of water a day, which is equivalent for the 60 families. And this has been great because most of them have reported that they haven't had any illnesses at the moment. We're not saying that this unit has only been the reason for this, but in Nairobi right now, there has been a cholera outbreak. However, we haven't heard any cases from this community settlement. So that is a plus point. But apart from that, we've got many other initiatives. Right after the first outbreak, Lamu branch was very quick to make a decision and use just about $100 to make 300 liters of soap, which they distributed across their county into the different islands, just to ensure that the communities are able to practice the safe and hygiene practices of staying safe and clean. We have Switch TV, which is owned by the Kenya Red Cross in partnership with ICHA. We also launched and aired an animated video just 2 days ago about how hands are to be washed. The reason we're doing a lot of awareness around this is because people are moving back to the normal life and feeling like this is no longer a serious issue, and just forgetting that they still need to keep cleaning their hands or practicing at least basic directives. So we have to keep doing different ways of awareness sessions with these individuals. But on the left, you'll see Kenya is one of the busiest public transport areas. So this is the Mombasa ferry services, where not less than, but more than 100,000 people travel a day, commuters, and these are all labor people who have day-to-day jobs, and it's basically daily wages. So they can't survive by staying at home as per the government directive, and they still need to travel. So what the government, together with the Red Cross, we did is we set up hand washing facility immediately on the 16th of March, and it's still operational. The Kenya Red Cross was providing the hand soap as of until mid-April, until the government was able to pull through some resources to sustain the need and the gap for hand soap. If you look at the image on this side, where on the right side is a very good example of how public transportation in Kenya is adapting this directive. So it's a simple jerry can that is attached to a matatu, which is a public transport vehicle here. And before getting onto the vehicle, everyone has to ensure they've safely washed their hands. But lastly, given everything that we're doing, our exact plan is to make sure that we do an impact study. So just like how we heard earlier, we need to do more research and document everything that's being done within the society. So we wanted to do an impact study, which is currently being done with our research team at ICHA. We want to continue having the one-on-one awareness creation and also develop the youth stories, because the youth have really, really come out right now with a lot of great ideas and creations around how to better respond to COVID and how to take this as a positive lesson. So we would just want to be able to document this to build the resilience for the coming generations, because at the moment where we stand, we do not want to remember 2020 as a negative year, but have a lot of positive things to learn from and take forward. So apart from that, that's from me. Thank you very much. I know I took a bit more time than I was supposed to. I apologize for that, but it was because of the small glitch in the middle. Over to you. Can everyone hear me? Okay. Yeah, I think you're on mute. Yes, you are.
I am on mute, and just to say, as we are doing this, Ian is taking over here in terms of co-host duties, so he'll be moving you on. Ian, you are here, right, and off mute. And perhaps not, Ian. For some reason, we cannot hear you. So please do try to check that out. I just really want to apologize to everybody for the slight technical glitches we're going through here. This is the first time we've been trying the breakout rooms in Zoom rooms, and so we're having just the odd hiccup here and there. Were there any particular questions for Priya?
Dirk, I think I see one from Sherry.
That's great, because I am looking at too many things. So if you can go ahead and address that.
Yeah, so Sherry, regarding the reason we had liquid soap compared to bar soap is because liquid soap is much faster to make. So given the time constraints at that moment, we did opt for liquid soap. Yes, bar soap is easy to move across your hands and fingers. However, when you have liquid soap, it reduces the contact of the same bar soap being used by many people. At the ferry, what we had was our volunteers were holding the bottles in their hands and just squeezing out some for the commuters so that they don't have to touch the soaps as well. In Lamu, the reason they made liquid soap is because they needed it immediately the next day, and with bar soaps, you need to give it a few days for it to treat and be ready for use. So yeah, but at the moment we are using both bar soaps and liquid soaps.
Thank you.
Priya, did you see any other questions there in the Google Doc for you?
No, not on the chat box, but I can quickly check the Google Doc. No. No, there's none on the Google Doc.
Okay. Any other question? Just a quick, if anybody wants to come off of mute really quickly and ask a question or type it in the Google Doc. Going once, going twice. All right. So let us transition now to Martin. Martin, are you ready to take over with the screen share?
Yes, hello everybody. So I'm activating the screen share.
Let's make sure that works.
Let's see.
Fabulous.
Okay. Okay. So I will present you this a Swiss approach, a Swiss Red Cross approach, which is very different to the approach of we already heard, but our society and our conditions are also very different. So I would like to present you a campaign we started at the beginning of the lockdown in Switzerland, the COVID-19 lockdown, which started in the middle of March. My name is Martin Welchli. I work for the Swiss Red Cross in the Department of Health Promotion. Next slide. Hoopla. Doesn't appear. What happens? I'm trying to bring you the next slide. Let's see. Okay, so you see it.
Yes, yes, we can see it, Martin. Go ahead.
middle of March, at this time, the Swiss government launched a well-catching campaign. It's even been translated in many languages for migrant populations in Switzerland, which was the first time that the Swiss government really translated a big campaign in other languages. So, next. Yeah. You know, in Switzerland, we've got 25% foreigners, and about 300,000 do not speak any national language or English. So it is very important, if we want to reach those populations, really to find ways that they understand the messages. We also have a poverty rate, even in Switzerland, of about 7%, which is really getting higher in the next years. So there are many people also in the poor population who are not used to read complicated messages and text. So it's very important to adapt the difficulty of the content for those populations. We, the Swiss Red Cross, we have got a web page called migesplus.ch, and this is a site about equitable health access. And what we offer on the site is there are several offers, and one of the most well known is we have about 450 publications about different health issues, and you can find them, you can download them, or even like order them in a printed version. And we very quickly we launched like all the COVID-19 publications available in Switzerland, also on our site, which is very well known in the for multiplicators and health professionals. They go on the site and they find the material they need for to give them to the target groups. And we realized when we were like publicating those tools that we need really to have an information tool, a campaign for the younger, because the younger, they understood like the message, like wash your hands and all that, they understood it, but they didn't feel like touched by it. They didn't really follow the rules. And I had the idea, I told it to our director, we need to do something very quickly for the young people in Switzerland. And this was what we tried to do. Let's see if it works. I have got other options to show you this movie, but I try the first option. So we produced in some days a movie with a Swiss comedian. He is very well known in Switzerland, and yes, he tried really to transmit this message in a way we hoped that it will be understood. Let's see. Difficult. Oh, okay. Okay. You understood it? Everything okay? It worked? Okay. So this was the movie, and we spreaded it over social media. But first, I just show you quickly how we produced it. It was really a very quick action, and Swiss Red Cross is not all the time so quick. So it was really, we were in a very special situation, and everyone knew that we have to act quickly. So day one was the idea. At day 10, the movie was launched. And this was really very good to see that we are able to act quickly, to collaborate with professionals outside the Red Cross, and to come to a product which is spreaded all over Switzerland. It was spreaded like in social media, and also on a website we have built it for that. And very important, I also would say it is an innovation of Swiss Red Cross. We, some years ago, we started to build a platform for the media of the migrant population. So we have many medias in Switzerland run by migrants for migrants in Switzerland. So this media, we have a close contact, and we also offer that contact to others, like health organizations who can, like via migrant media, and transmit their health messages to the migrant population. And those medias, they agreed like to transmit the movie, and after that also all the relevant COVID-19 information of the government. So we got money from the government to give to the migrant media, like we gave them the money, and they were doing campaigns for the target groups, which is still working and is working very well. They reach really a huge part of population we can't reach, or mainstream media can't reach very easily. This is the result, like the impressions and the reach of our movie with the comedian, which was really impressive. I think we never produced a movie in the Swiss Red Cross which was like the same, like reached like this movie. And the Swiss television, they offered us also like to show it hundreds of times for free, nearly for free. So, and they did it because they had like some advertisement, they gaps, and in these gaps they could put this movie. Our learnings. So I told it before, we acted very quickly, and I think for the future we should really improve our decision making. It should be simplified. Another learning, the humor of the comedian was not in every language. It was really understood equally well, like in German. I don't know how you recepted the movie. Maybe you also thought, is it funny or is it serious or whatever? In German, it is really well. The people understand it very well, and in other languages, in the translation, were some feedbacks. They told us they didn't understand it really well, and yes, we subtitled it in 15 languages. There were some subtitles like going too fast for the target groups. And what we also learned that cultural workers are willing to work for the Swiss Red Cross. It is really easy to reach them, to enter in collaboration, and this was really good to see. Actually, we are translating like a proximate tracing app built by the government. Now this collaboration is really close, and they don't forget the Swiss Red Cross when they are developing new stuff. And we were able like to translate this app, which is offered in the national languages and the English, and we translated it in more languages. So it's very important that all people understand what this app is doing and what it is not doing. Like it is not a tracking, not a geographical tracking app. So this is the end. Thank you very much.
Sure, Martin. Thank you. That was great. If you have questions, feel free to. Thank you. Yeah, if the group has questions, I mean, feel free to put them in the chat, or raise your hand quickly. Maybe just to put one question in while people are thinking. Martin, Priyanka talked a little bit around the impact studies, and I was curious if you had plans to look at the impact specifically. Like you presented a little bit the analytics, but are there other things you will do to look at the impact of the messages with the video?
Yeah, this is difficult to say. We had a lot of like positive feedbacks from multiplicators like social workers and teachers. They told us that really the audience, the target groups, they accepted the message and yeah, they really try to act in the way this comedian is recommending. So, but we didn't like analyze that in a deeper way.
Okay, thanks. Maybe one quick question too. So you shared a little bit the ways you thought that the Swiss Red Cross was able to act in a more agile and quick manner.
Yeah.
But I was curious, maybe just to tie this back to Priyanka, if there were any of those comments that resonated with your own experience in Kenya, if you had additional thoughts on this idea of agility and quickness.
I'm not sure I got that question right, Ian. Are you asking if we had similar thoughts in Kenya?
Just around the questions around agility and being quick in decision making and action, like if the points resonated or if you had other experience.
No, so definitely they did resonate. So in terms of with Kenya, what happened is the challenges we faced is a lot of people were being very ignorant as well, because this is something that they felt the Kenyan, they felt that the government is just trying to bring in control. So they were a bit receptive initially, and then the government had to come in with more strict directive of curfews and lockdowns and containments. So this helped in containing the entire situation, at least for now. But in terms of the Red Cross end, we had to make very quick decisions initially because we somehow were prepared because the rest of the world was going through it, but we didn't expect it to come like this, the way it did it to Kenya. So as I presented, most of our challenges were achieved within a few days. So the first one, the 1,000 Ways Challenge, was decided today, and tomorrow we did the video and put it out. The same thing with TippyTap, we gave volunteers 1 day to submit and we got the response. And with the plasma project, it was already existing. So we just had to have the discussions with the government to allow access to the facility for access of water, and that was granted. So for about 3 weeks, that unit has been functioning and supporting the household needs for water. So a lot of these things were quick decision-making moments.
All right, excellent. I know, unfortunately, I think we've run out of time in this group, but I just put the link in for the main plenary session. So if everyone wants to plan to regroup over there, we will capture a few more notes and share all the presentations from each of these sessions. So there'll be more follow-up on that. But thank you again, Priyanka. Thank you, Martin. Those were wonderful examples. And everyone, yeah, please rejoin back in the plenary. It's just a brief wrap-up, and hopefully we can see you all there. I'll stick around for a few minutes if there's any questions around how to rejoin. But otherwise, yeah, we should go ahead and leave this room and go back to the main Zoom room, if that makes sense. Thank you.
Thanks, Ian.
Thank you.
Hi, Gwen, are you still with us or?
Yeah, I was just making lunch and I had to clean my hands before I could leave.
No worries.
I'm out now.
I assume you can find your way back, so yeah, cool.
Yeah, I'll be back. Ciao.
All right, see you there.
Thanks, Ian. I'm closing this out.
Perfect, thanks.